Adrian N. Breitfelder, City Clerk, you are hereby directed to call a regular session of the City Council to be held on Monday, August 15th, 2022 at 6:30 p.m. in the historic Federal Building for the purpose of conducting such business that may properly come before the City Council.
Thank you. Good evening, and welcome to a regular session of the Dubuque City Council for August 15th, 2022. As a reminder to our participants, you can provide in-person input or virtual audio and written input during the sections of the agenda where public input is accepted. Input options during the live meeting include: in-person attendees may approach the podium when the mayor asks if there is any public input on the item they would like to speak to. Remote attendees can log into GoToMeeting using the login links, phone numbers, and access code that appear on the broadcast and live stream and posted on the front page of the meeting agenda. This option includes audio input and written chat input. If you are participating via computer, indicate which item you would like to speak to in the chat function, or note that you would like to speak during the appropriate section. If you are participating via phone, indicate which item you would like to speak to when phone lines are unmuted. All phone lines will be unmuted during the consent agenda, public hearings, and public input periods, and city staff will determine the speaking order of the participants. All comments, whether in person or virtual, must be accompanied by a name and address. Additionally, written public input is accepted by contacting the City Council directly from the city's webpage at www.cityofdubuque.org/councilcontacts and through the City Clerk's office email at ctyclerk@cityofdubuque.org. This information will be reiterated during the meeting. Attendance for the session is as follows: Mayor Kavanaugh.
Here.
Council members Farber.
Here.
Jones.
Here.
Rusnick.
Here.
Roussel.
Here.
Sprank.
Here.
Wethel.
Here.
City Manager Van Milligan. City Manager Van Milligan. I see that he's on the GoToMeeting, so I'll mark attendance, but with some tech issues, and City Attorney Brumwell.
Here.
Thank you. Mayor Kavanaugh, I will turn it over to you for the Pledge of Allegiance.
All right, thank you, Adrian. I invite all who are able to rise and please join us for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
For presentation, we have the COVID-19 update.
Good evening, Mayor and City Council. I'm Mary Rose Corrigan, Public Health Director with the City of Dubuque Health Services Department, here to give you an August 2022 update on the COVID-19 pandemic. As you can see, the overall epic curve, our latest increase and wave that started at the beginning of April, is kind of in a maintenance mode. Numbers continue to stay elevated, and that is evidenced by our latest case counts, which we're doing on a 7-day basis. And if you remember, these are the cases that are diagnosed through healthcare professionals and Test Iowa through official testing, not through at-home test kits. I put some older graphs above these slides from before this surge started back in February and March, and you can see how much lower the cases were and the hospitalizations were also lower. And so this just demonstrates what that Omicron variant and the sub-variants continue to do. We have two metrics we use through CDC. One is the CDC Community Level, which refers to the measures of impact of COVID-19 in terms of hospitalization and effects on the healthcare system while accounting for transmission in the community. So these two maps illustrate that we are at a medium community level, and the numbers there are updated once a week. The national map was more orange a few weeks ago, but it's interesting to see how that orange kind of shifts around the country a little bit, and it's kind of shifted more east right now. So nobody really has an explanation for that, but this is a tool you can use when traveling and knowing what precautions to take when you're out in public. We continue to monitor the variants, and they're all the testing that is done on cases for variants are all 100% Omicron, with those BA.5 and BA.2 and a few other ones with a much longer number on them that are related to BA.5 and BA.2. So we're just starting to get August numbers, but it's looking the same for those variants. And that is pretty much the case around the country and the world, quite frankly, with those variants. Now, our vaccination rates crept up about 1% or 0.5% since July in many of these categories. The Iowa Department of Public Health is no longer reporting vaccination data on their public health dashboard, which local public health people like me have access to. Nobody's been publishing yet the less than 5-year-old age group vaccination data, but I ran that number back in July before the state discontinued it, and it was less than 100 vaccinated in that age group. So not very good in that less than 5 age group, not much vaccine uptake, and our VNA says that they're getting minimal vaccine uptake in that young pediatric age. We are not unlike the rest of the country, a lot of vaccine hesitancy there. So how many kids have been infected? Well, there is a national seroprevalence antibody study going on since last fall. And in February, they looked at a 3-month period, and they saw that, and this is funded by private commercial labs that get these tests and submit the results for analyzing, that about 75% of children tested in a 3-month period had signs of previous infection with COVID-19. Now, the antibodies they're monitoring, they don't say how much immunity they have, but they can tell that they were infected through that. And in Iowa, in the most recent, this slide didn't turn out very well on this PowerPoint, but it's estimated that we have about 84% in the last 3 months sampling study of 259, I think, something like that, cases, whereas 85% had been infected with COVID. So there is a high infection rate, but you also have to consider that's over a 2.5-year period also. So some of that may not be providing protection against new infection. But it does give you a sense of an estimate of how many of that pediatric population has probably been infected. Just some new data I thought I'd share to kind of paint the picture of where we are. So if we look at our basic numbers, and CDC does have basic age group numbers of vaccination rates for Iowa and Dubuque County on their website, 74% of the county's 5-year-old and older population has at least 1 dose of vaccine. Our 65 and older population has 82% up to date, and with 1 booster, that is. And almost 60% of the residents 12 and older are fully vaccinated and have 1 booster dose. So you can run a lot of different categories like this, room for improvement in all of them. The most vaccinated, up-to-date, boosted group is our elderly population over 65, which is good because they're probably the most vulnerable. I will add one little thing. Well, I can do that on the next slide. So with kind of the low uptake in vaccinations for our pediatric population, and particularly our younger pediatric population, we're doing some extra educational efforts for childcare providers. And this is just part of a flyer we've developed to distribute electronically, talking about the benefits and of vaccination and why they're safe, those kinds of things. And for parents who have children in childcare, which is 0 to 6, and then they head on to school. So this will be appropriate for those younger age groups, and we're getting that out this week, I believe. As CDC, they are kind of going down the path of more individualized guidance. based on your condition, your family, your community, and kind of going towards people making their own decisions about COVID. And this is kind of more of a medical model because it's an individualistic model versus a population health model, like a public health model where we have broad-based guidance for the greater good of the community. So I'm not saying either one's good or bad, but it is a challenge because if you are immunocompromised or have special considerations, you're going to have to take into consideration a lot of people are just more concerned about their individual health status out in public versus that of the community. But we do know that it's still very important to know your risk. I think one thing a lot of people learned during the first part of COVID is they had underlying health conditions they didn't know they had. And when they were evaluated for COVID, oh, well, you have diabetes too, and these other factors. So it's important to know your risk, your health status, so that you can do extra protection if you do have those underlying conditions. Protect yourself, of course, vaccinate. We still recommend wearing masks in crowded public places and fully endorse outdoor activities. And also continue to take action if you're sick or test positive, and use those home test kits or the Test Iowa or your healthcare provider also. And one thing on the social distancing, the CDC has kind of gone away from the 6 feet marker. And really that kind of makes sense because if you're 8 feet away from someone and you're in the same room with them for a prolonged period of time, you probably have just as much of an exposure if you were 6 feet away for 15 minutes. So it's a practical guide that, especially if anybody's symptomatic or they don't know, or you may be immunocompromised. So CDC did come out with some updated guidelines last week, and they're not all the way filtered on all those CDC web pages yet. They're updating all those different sections. But basically, they kind of have a more refined goal, and that is to reduce severe illness. And I think with the vaccination efforts and all the guidance that has been out, especially in the last 3 months, we can say that we've definitely reduced severe illness. Since June 1st, we've had 3 deaths, which is very low. And our hospitalizations, as you can see from that slide, continue to be low. And as a reminder, some of those numbers on the hospital chart are people who are in there for other things that may happen to have COVID. So they're not all severely ill with COVID, and we know that the COVID patients in the intensive care unit has drastically been reduced. So we want to reduce severe illness and death, but in the meantime, in order to keep doing that, we have to keep working on vaccinations and getting more people vaccinated. So basically, the main change in the CDC guidance is that there's not as big a differentiation between what to do if you're vaccinated or not vaccinated. So if you have an exposure to a known case of COVID, whether you're vaccinated or not, quarantine is no longer required, but you're supposed to wear a mask for 10 days and test on day 5 after exposure. And if you continue to be asymptomatic, then you don't have to quarantine. If you are positive, regardless if you're vaccinated or unvaccinated, you're supposed to isolate for 5 days at a minimum. And then if your symptoms are improved, meaning you don't have a fever and your cough is improved, etc., you can discontinue your isolation if you wear a well-fitted, preferably N95 mask if you go out in public. And you're also supposed to avoid immunocompromised people who are at greater risk. It's also recommended that if you have moderate or if you are at risk for moderate or severe illness from COVID, like you're immunocompromised, have an underlying condition, and you get COVID, that you isolate for 10 days. Or if you get significantly sick, not a mild illness, or you have to be hospitalized, it's recommended to isolate for 10 days. So a lot of this is it's subtle changes, and we'll continue to work with the community and schools and other groups on how to navigate this change. And not everybody organization has to go along with these changes. They can continue to recommend or adhere to longer quarantine or isolation periods if they want. These are guidelines. So looking ahead, what we're working on is the incident management team has secured a contract with a vendor to help us with the after action report, and that's through the county health department did that contract. There is a section under it where we will do some specific after action reporting for City of Dubuque activities in terms of our safe workplace guidance, keeping services running, those kinds of things. So that after-action report, the goal is to have it done by December. We'll have wide community input into the after-action report. We will do interviews and surveys with our community partners, stakeholders, and people involved with the response. So that will be underway, and I'm kind of looking forward to doing that, because part of an after-action report is to document what you did, but then also come up with a plan to improve what needs improvement. So some of you council people may be getting called by our consultant for an interview or an online survey, and I'll prep you a little bit more before that happens. We do have some modifications to the incident management team. Samantha Cloft, the interim county health department director, has moved on, and she's furthering her education, and the county is still in the process of hiring a director. So in the interim, the VNA is going to oversee the kind of the management and administrative functions of the county health department. They already have an existing contract with the county, and we're going to be meeting more with the Board of Health to talk about other services that need coverage while that director recruitment and hiring is ongoing. And finally, one thing we've learned over the past few years is that things seem to be going okay, and then school starts and things kind of increase, or we have a lot more cases. So we're going to be monitoring that and working with the schools. We're going to keep our weekly updates going, because we, just in case things happen to change, and it is with, kindergarten through high school, but we also have several higher education institutions in town that affect a lot of our transmission also. So we're going to be watching that closely this fall as it gets underway through September. And that's what I have prepared for my update. I'd be happy to answer any questions.
All right, thank you, Mary Rose. Questions for Mary Rose tonight?
Mr. Mayor.
Yeah, Mr. Resnick.
Yes, I was rather surprised. I went into the Medical Associates Clinic the other day, and masks were, voluntary. Even with a lot of people who I think are vulnerable coming in and out, and it just goes to what you said, I think, about they're really relying on individuals to make that decision. But it just seemed to me that we were definitely walking back a little bit from the idea that COVID is a persistent problem, because anyway, I had it in my pocket ready to go because I thought for sure it was going to be required. So is that pretty common now that most of the medical facilities, masks are optional?
I think we haven't done a survey, but there's a number of them that still require masks. And I think some may require masks in certain areas, if I'm not mistaken. But so it's not everywhere. There are still mask requirements out there.
Thank you.
Ms. Wethel.
I think at the last update, we had talked about kind of a lack of distribution of the oral antivirals. My impression is that is going better. People know to call in when they get a positive test now, maybe, who are mostly at highest risk anyway. One thing that I thought about is that I personally see some of these people, and what we do is they do a home test, it's positive, and I prescribe them oral antiviral, but that test is never recorded as positive.
Correct.
And so a number of prescriptions are going out the door, I know, in our pharmacies locally for oral antivirals. And many of those, because they're not seen in person in a clinic setting, are not recorded as positive tests. And so I see a lot of those.
Right.
And I just, I want to make sure we're continuing to get education out the door as far as make sure you call your provider if you have a positive at home.
Well, and that is a very good point, because it's not going to be officially documented under a person's diagnoses or tests. It's probably under the diagnosis. But we recommend that if a person is positive, they call and let their healthcare provider know. So a note can be made in their health record. And if they did a Test Iowa test, perhaps, or from a test site somewhere, they can submit that documentation, because moving forward, it may be to their benefit, especially if there's requirements on vaccination or recent infection within 90 days, they'll need that documentation. But if people want documentation officially outside of the rapid test, you can always submit a Test Iowa PCR test for free through the UPS mail system. So it is a point. And I know a couple months ago, I saw a statistic that said, there's probably at least 7 times more positive cases than what's being reported. I haven't heard an estimate on that lately, but we know that it's many more. And in fact, anecdotally, when I hear of people I know that are infected, they're usually not on the list of positive cases that I see, so. But I'm still happy that people are using rapid tests as a tool to know that they're infected.
Any others? Okay. Well, as always, thank you, Mary Rose. You continue to give us great information, and we really appreciate you coming every month to talk to us about this and keep us posted.
Okay, you're welcome.
All right, Adrian.
We will move on to consent items. At this time, anyone participating in the meeting in person who would like to discuss one of the consent items, please approach the podium when the mayor asks if there is any in-person input and state your name and address. For all remote attendees, please enter your name and address in the chat function or state your name and address over the phone when the mayor asks if there is any virtual input. If more than one participant would like to speak, then city staff will determine the speaking order of the participants. Please state the item you would like removed from the consent agenda for separate discussion and consideration. And consent items can be found on pages 2 through 6 of the agenda.
All right, thank you, Adrian. Do we have anyone here in chambers who would like to speak about any of the consent items on the agenda this evening? Yep, come on up.
Ryan Sempf, VP Government and External Affairs for the Dubuque Area Chamber of Commerce, 7819 Commerce Park, Unit 300. Just wanted to thank council. One of the items on the agenda is a letter regarding the refugee resettlement program, and just
Okay.
want to
So here's what we'll need.
do I have to pull it? Is this only?
Do we need to
I
pull
wanna
it for
it off?
a general thank you? We probably
Yes.
should. Okay, so yeah, so if you could just give us the number, we'll pull it, and then you can come back up and we can.
I don't want to pull it. I just want to thank you. Do I have to pull it to talk?
Our attorney says yes.
You do.
Mr.
Okay.
Yeah, and that's okay.
I can just kind of wander back.
You know what? Go ahead, and it's, and for anybody's knowledge, I mean, all it is an extra motion and a second and a vote for us to be able to talk about in these items separately. We're happy to do it. So if there's an item specifically, we'd love to do it.
I'll just pull that off. I do not have the number in front
It's
of
number
me.
22.
Number 22.
Okay, all right. We're probably going to call you back up to just finish your sentence because I know I cut you off there, so not right now, but yeah. Thank you very much. Okay, anyone else who would like to talk about any of the other items separately? Okay, and I'll bring it back to the table. Or I'm sorry, is there anyone virtually? I know you're watching.
There is not.
Okay, thank you very much, Adrian. Bring it back to the table then. Mr. Mayor. Yes, Mr. Resnick.
I move to receive and file the documents, adopt the resolutions, and deal with the consent items as recommended, except for number 22.
Second by Farber.
All right, we got a motion by Mr. Resnick, second by Ms. Farber. Adrian, would you call the roll, please?
Resnick,
Aye.
Jones.
Aye.
Kavanaugh.
Aye.
Farber.
Aye.
Wethel.
Aye.
Roussel.
Aye.
Sprank.
All right, that motion passes 7-0. Now, Mr. Senf, number 22, I cut you off in the middle of your sentence, so you can go ahead and finish that sentence that you were having, and we appreciate you being here tonight.
Sorry, I'm rusty on my Robert's rules. Just wanted to say thank you for council for considering this on the agenda today. We think it's important. as we face a workforce crisis, to acknowledge all ways that we can bring people into the community and accept people and be a welcoming place. And so we thank you guys for looking at that letter. Yeah, thank you.
All right. Thank you very much. All right. Any discussion on this particular item?
We actually need a motion.
Oh, before he came up to speak, probably technically.
Probably, but that's all
Now
right.
I'm
We'll-
rusty on my Roberts rules, Mr. Steff. I apologize to everyone for
I
this.
didn't want to interrupt him again.
Yeah, thank you. Thank you,
Mayor.
Brenna. Yes, Mr. Jones.
Move to receive, file, and approve item 22.
Great, thank you.
Second by Roussel.
All right, we got a motion by Jones and a second by Roussel. Thank you very much for having patience with me. Any discussion on this particular item? All right, then that we have a motion and a second. That would be to receive and file the letter. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones.
Aye.
Kavanaugh.
Aye.
Farber.
Aye.
Wethel.
Aye.
Roussel.
Aye.
Sprank.
Aye.
Motion passes 7-0.
We will move on to items set for public hearing, and we have two. First is Comiskey Park Phase 1 redevelopment project for August 22nd, 2022. And second is Carnegie Stout Library Roofs 1 and 2 restoration project for September 6th, 2022.
Mr. Mayor,
Ms. Roussel.
I move to receive and file, adopt the resolutions, and set the public hearings for the dates and times specified.
Second by Sprang.
We got a motion by Roussel and a second by Sprank. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones.
Aye.
Kavanaugh.
Aye.
Farber.
Aye.
Wethel.
Aye.
Roussel.
Aye.
Sprank.
Aye.
Motion passes 7-0.
We will move on to boards and commissions, and we have applicant review for the Airport Commission and Zoning Advisory Commission.
All right, so our first commission is the Airport Commission, and we have two four-year terms through September 14th, 2026, and we have two applicants, Robert Blocker and Michael Phillips. Is there anyone present to discuss these applications with council this evening? Yeah, come on up to the podium and please introduce yourself and give your address, and then you can address us.
Mr. Mayor, City Council, I'm Robert J. Blocker, 880 Kane Street, Dubuque, Iowa. I kind of go by the nickname of RJ. I'm here tonight. I'm applying for an additional term with the Airport Commission. My existing term expires in September. So I've got several years of experience out there. And not only have I worked with the Airport Commission several times, I had a couple years with the Park and Rec Commission. I was very active in Bring Back the Train program to Dubuque, which is still talked about. Whether or not that happens is a darn good question. Anyway, I've enjoyed my time spent working with the Airport Commission. I've seen tremendous growth out there and improvement out there, everything from the physical plant, new hangars, new taxiways, on and on and on. And we're very fortunate to have the University of Dubuque has got a real active first-rate aviation program going out there. And we certainly know that there's a huge shortage of pilots out there. But speaking of pilots, I hold a private license. I learned how to fly out of the Dubuque airport. And I'm still considered to be a flight officer with the United States Air Force Auxiliary, known as the Civil Air Patrol. So I'm here tonight to ask for your consideration that I could receive another term, and I'd be happy to do that. My wife and I have flown many times out of Dubuque to visit family out in Utah and out in Colorado, and they in turn have made flights into Dubuque. And unfortunately, on the subject of flights right now, we certainly face major challenges with our existing passenger service will expire. I believe it's on the 7th of September. So there's some major challenges out there that we're facing. We're not alone. A good friend of mine flies with United, and I was just visiting with him Saturday afternoon, and he said, it's unbelievable. He's been flying with American first and then United, and he said he's never seen the industry in such disarray as it is right now. So anyway, that's going to be a major challenge for us, and I'd like to remain on board here to help whatever I can do in any way to try to get some kind of air service restored back to Dubuque, Iowa. If there are any questions, I'll attempt to answer. Seeing none, hearing none.
All right. I see smiles, Mr. Blocker.
I will thank you for your consideration and your time this evening. So with that, I'll say good evening all.
Thank you very much for your comments. We appreciate it. Anyone else to address on either of these applications? Anybody virtually, Adrian?
No one virtual.
Okay, then I'll move on to the next application here for the Zoning Advisory Commission. We have one 3-year term through July 1st, 2024, and Ryan Semp is the applicant. We have.
I'll just be very brief. I don't have the resume of my colleague that was here with service in the Air Force, but I saw the opportunity to serve my community in a role of servant leadership, and really look forward to the opportunity to be a part of the Dubuque community in a greater way. So appreciate your consideration of my application. Thank you.
Thank you, Mr. Semp. All right. Anyone else to address the council? Nobody virtually?
No one virtually.
Okay, we can move on then, please, Adrian.
All right, we do not have any public hearings for tonight, so we will move on to public input. At this time, anyone participating in the meeting may address the City Council on the action items on the agenda or on matters under the control of the City Council. For all in-person attendees, please plan to approach the podium and state your name and address. For all remote attendees, please enter your name and address in the chat function or state your name and address over the phone when the mayor asks if there is any virtual input. If more than one participant would like to speak, then city staff will determine the speaking order of the participants. Individual remarks are limited to 5 minutes, and the overall public input period is limited to 30 minutes. Under the Iowa Open Meetings Law, the City Council can take no formal action on comments given during public input or that do not relate to the action items on the agenda.
Thank you, Adrian. Do we have any public input this evening?
Good evening. My name is John Dunham. I'm a Dubuque resident at 1955 Pulpit Rock Lane here in Dubuque. I'm here tonight as the Vice President of the Dubuque Soccer Alliance, and I'm here to provide an update on where our group currently stands as the Dubuque Community School District prepares to sell the Dubuque Soccer Complex property. I'd like to start by clarifying to Mayor Kavanaugh and our City Council who it is I represent today, the Dubuque Soccer Alliance. This organization was formed in order to best serve soccer players of all ages and ability levels as the sport began to grow in Iowa in the early 1990s. The growth at that time somewhat coincided with the 1994 FIFA Men's World Cup being held in the United States, and the state of Iowa sanctioning the sport at the high school level around that time. Since then, the FIFA Women's World Cup has also been hosted on U.S. soil twice, and in 2026, the men's tournament is set to return to North America and the United States. In today's youth sports climate, with the cost of participation and travel rising, soccer remains a low cost of entry sport. With just a ball and some space, soccer players all over the world are able to play a basic version of the game almost anywhere. With a set of shin guards, some goals, and additional space to play, a more formal version can be seen in cities big and small all around our country. I'm here tonight because locally, our user groups, the Dubuque Soccer Club, AYSO, and Key City Soccer Association especially, are offering just that experience. In fact, our local version is less costly than many of our Eastern Iowa peers. Additionally, each of our user groups also offer scholarships up to 100% of the cost to participate for those who may not be able to meet the entry-level cost. Many of our nearby soccer peers also operate their programs at city-owned park space. We, the Alliance, have operated and maintained the existing soccer complex here in Dubuque at a high level in cooperation with the school district and the city for nearly 30 years now. The Soccer Alliance's budget has historically been narrowly focused on maintenance and modest upgrades as tenants of that space. Our groups and renters submit a user fee to us, and those fees simply offset our costs to do what we've always done: provide a safe and well-maintained area for local players to compete, learn, and grow. We've welcomed guests from around the area to play in league games and hosted tournaments on and off for our entire existence. Among the guests we've welcomed to the complex recently is Emiliano Gomez, joining us here tonight. Emmy is a native of El Paso, Texas, began his collegiate soccer career in Colorado before arriving in Dubuque to play at Clark University. Most recently, he's completed his time at Clark, joined the Iowa National Guard Reserves, and remains an active member of the soccer community here in Dubuque. He's volunteered this summer to referee and plays in the men's league in town. Most notably for me, he played for Union Dubuque when I was the head coach. This is where I got to know Emmy most as a person and a player. The local adult amateur team, which also welcomed league games and visitors in from out of town. For a portion of his time with Union, Emiliano wore the captain's armband, leading our team. Just last week, he took the Dubuque Police Department's oath to serve our community with integrity, compassion, competence, and an open mind, where he received his newest uniform, an officer's uniform and his badge. Emmy's friend and mine, Max Contreras, has a nearly identical story and was also sworn in last week with the Dubuque Police Department. This is just one example of what the soccer community here can do for Dubuque and our neighbors. Another example of the programming provided at the complex is the utilization of our space as a local cross-country course, a space we intend to continue to provide for the wildly successful running community here in Dubuque. I share with you this history and tell you these stories to remind you of what we're capable of as the Alliance, and to share with you how excited we are to be the potential owners of the space. Ahead of the publicized deadline, the Dubuque Soccer Alliance has submitted a bid to purchase the land as laid out by the Dubuque Community School District. Should our bid be accepted, we've also been working on plans to improve and enhance the space in some very exciting ways. These plans are not without thoughtful consideration for our role in the Dubuque community. This includes a recent outreach committee we've put together. We believe we match up very well with Imagine Dubuque's land use initiatives, like providing recreational opportunities for all segments of the population, sharing facilities to serve existing and future neighborhoods, and the potential to link existing and future development with open space. As we look ahead to our next chapter as an alliance, we're doing it with the people of Dubuque in mind. After nearly 30 years of investments, ranging from our volunteers turning farmland into soccer fields to any sort of significant financial contributions, we're excited to do more and be more as an organization. Should we become landowners, that includes things like potentially rewriting our bylaws to reflect the mission and vision and philosophy of those user groups, the local soccer organizations, more directly and overtly publicly. I want to thank you for considering partnering with us down the road in any number of ways, including a financial investment, so we may own that land and achieve our goals. I want to thank you for considering to offer your collective support for our bid, and I'm happy to answer any other questions anyone may have here tonight. On behalf of the Dubuque Soccer Alliance, thank you for your support and participation with us over the last 2 decades, and thank you for your time tonight.
Thank you, John. We appreciate your comment. Do we have any other public input this evening? All right. Do we have any virtual input?
No virtual input.
Okay. Then we can move along.
We'll move on to our action items. Action item number 1 is introduction of Assistant City Attorney Jason Lehmann.
Mr. Mayor,
Mr. Jones.
would we receive and file and get introduced?
I have a motion by Jones, a second by Sprank. Turn it over to Krenna.
Hello from down here. I haven't been down here in a while. I just wanted to bring Jason formally and introduce him to you this evening. I'm sorry, Krenna Bromwell, City Attorney's Office. I wanted to introduce you to Jason. He has been with us since the end of April, I believe, working as Assistant City Attorney. And as I anticipated, he has jumped right in on a number of different projects and initiatives. He has made his way around the organization, meeting everyone and getting acclimated to all of the fun that he gets to be involved in as part of our office. And just to give you a little bit of background on Jason, prior to coming to the City Attorney's Office, he was a solo practitioner for a number of years, and prior to that worked at the Firsty Law Firm and spent a little bit of time with the Iowa Civil Rights Commission while he attended Drake Law School in Des Moines. So he comes from a very well-rounded background related to civil rights and constitutional law, First Amendment issues, as well as having some municipal experience while he was in private practice. So I just wanted to bring him. I will let him introduce himself any more if he would like, but also wanted to let you know that he's going to jump right in and will be attending goal setting with you on Monday night in my place, as it's Holden's 9th birthday, and I will be at Happy Joe's having pizza and ice cream sundaes.
Thank you, Krenna. Like she said, Jason Lehmann, and I'm happy to be here. And I'm looking forward to working with all of you, and I guess I will see you all in about a week, next week, Monday.
All right. Well, thank you very much, Mr. Lehman, for being here this evening and for volunteering to come with us. I think we should probably hold goal setting at Happy Joe's from now on, but that's another business that we can tend to then. But thank you very much for your work and for your service, and we're very impressed with your background and looking forward to working with you for many years to come.
Thank you, Mr. Mayor.
Thank you.
Mr. Mayor,
Yes. Mr.
may I
Ed? recommend
recommend that Mr. Lehmann bring a jacket or perhaps a blanket on Monday? It gets pretty chilly.
Bundle of firewood.
A bundle of firewood works as well. Yes. Yes. All right, I'm guessing there's no more comments other than that one. Yeah, okay, wonderful. Then we have a motion by Jones, second by Sprank. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones.
Aye.
Kavanaugh.
Aye.
Farber.
Aye.
Wethel.
Aye.
Roussel.
Aye.
Sprank.
Aye.
Motion passes 7-0.
Action item number 2 is Dubuque Soccer Alliance letter.
Mr. Mayor,
Mr. Resnick.
I move to receive and file.
Second by Farber.
Got a motion by Resnick and a second by Farber. Krenna, please.
All right. I am going to be reading the city manager's correspondence this evening. The enclosed letter from John Denham, representing the Dubuque Soccer Alliance, has identified a short-term need and a long-term request. The short-term need is a letter of support for their bid to acquire the Dubuque Soccer Complex from the Dubuque Community School District. As a separate item on tonight's City Council agenda, the city manager is recommending approval of that letter. As far as the long-term request, the letter clearly states, quote, "The Dubuque Soccer Alliance will be submitting a sealed bid to the Dubuque Community School District to acquire the Dubuque Soccer Complex, having received full funding to support our offer," end quote. The letter goes on to request $300,000 from the city because the Dubuque Soccer Alliance has an intent to do some, as now undefined, quote, "improvement and enhancement plans," end quote. The city manager asks that this communication from the Dubuque Soccer Alliance be received and filed. The City Council has annual goal setting coming up later in August. If the Dubuque Soccer Alliance is included in the City Council priorities, then through the fiscal year 2024 city budget process, the City Council would decide what would be the form of a partnership with the Dubuque Soccer Alliance. The city manager respectfully recommends Mayor and City Council receive and file the letter from the Dubuque Soccer Alliance.
All right, thank you, Krenna. Before I open for discussion, just to clarify, when we have an item like this where we split something into two different action items, it would seem that we would want to be a little more careful about making sure we discuss the item that is currently on the floor
Yes, sir.
before we move on to the next item. So for instance, in this case, if I'm not mistaken, what we're voting on right now is receiving and filing the letter from the Dubuque Soccer Alliance. The next item on the agenda would be to receive and file and approve the letter from our city manager to the Dubuque School Board.
Correct.
Correct. Okay. So just to clarify that before we open up for any discussion, but I will open now for discussion on the action item number 2 here.
Mr. Mayor.
Yes, Ms. Farber.
And thank you, Mr. Resnick. I wanted to just echo the remarks that was made by the group sitting back there regarding the soccer complex and the accomplishments that have been made for the city of Dubuque and its families for over 30 years, developing wonderful, the families appreciating it very much, and also for the student athletes. And just again, kudos for the lifelong lessons that you were remarking about, and that this is so important to the student athletes so that they learn how to work together as a team. There are goals that they attain, and in this case, literally and figuratively. But I think it's just really a very important place for the city of Dubuque to think about as we go forward, and best of luck with the land ownership. And then I will look forward to a follow-up with goal setting if that indeed is attained. So thank you again for being here and expressing your sincere fondness, if you will, and your dedication to expanding this for the students and for their families.
Thank you, Ms. Farber.
Mr. Mayor?
Further, Mr. Resnick?
Just quickly, I agree with everything Ms. Farber said, and as usual. And I appreciate the history that Mr. Denham gave, and reminding us of what great work is going on out there, and so many community volunteers. Dubuque is great for attracting community volunteers, and that's that's fantastic. So I wanted to, and I appreciate everything that goes into this request, and I guess I'm going to stick with that. I mean, I've been out there many times, and the enthusiasm that people have, not only for their individual families and children, but for the facility itself is really great. So it is an important part of our community. And I do hope, I want to add my voice to those who hope that the school board will consider this as an important educational opportunity here in Dubuque and look on it favorably. Thank you, Mr. Mayor.
Thank you.
Mr. Mayor,
Yes, Mr. Jones.
I agree with the manager's recommendation that we should run this through goal setting and see where it takes us. Now, just to manage expectations, and I can't believe what you guys have done with the place. The product that you've given the community with sweat equity and real equity and everything else. And I agree with Mr. Resnick. I hope the school board finds the right answer. But just so you know about goal setting, got the books tonight. This is what we're going to be talking about in 3 nights. There'll probably be about 200 fabulous ideas presented to council. They come from us individually through a facilitator in private interviews last May. They come from the city department managers who've been meeting with the facilitator in the last several weeks, and they're all coming at us next Monday, getting carried home with us tonight to start looking at. And I don't think you're probably even in there yet. You'll get there. One of us will absolutely, I'm sure, do that. So the challenge for us in goal setting, and this is just kind of good for everybody to review in your heads, Soccer Alliance or otherwise, city-wise, is we take this 200 things that are divided into categories, quality of life categories, public safety, other things, and try and sort out which 10 or so could be done. And every one of them is really great things. If you did any one of them, it'd be great for the community. So we got to sort out, and it's painstaking and ugly and hard. And at the end of the night, we've got a very short list, which right now I'm kind of hoping you're on. But having not seen the other 200, I don't know if I can get you there or not. The city budget works kind of uniquely. When we set the budget last March, every dollar's already got a place, so there's not loose money we can say, well, let's just take this and spend it here. It's already appropriated and aligned to a place where it has to land. So we'd be talking at the earliest purchase authority would be next July on the way state code works. So personally, I'm hoping we can pull this off. I certainly hope that you acquire ownership of it. And I just want to take a couple minutes and let you know what we're up against in the goal setting thing so that so you're not too mad at us at the outcome if it doesn't bounce the right direction for you. Thank you.
Thank you, Mr. Jones. Ms. Wethel.
Although I guess I could wait till action item number 3. I'll just go ahead and put my thoughts in. When I've received comments from the community, I will tell you I received only one in an email this week that did not encourage us to seek out funding if you acquire the property. One. I have heard many in favor of this. I have put them into 2 themes in my own head. The first is a theme of belonging, and it's belonging as in I belong, or you belong here. And children don't have enough of those experiences to fill a cup, many of them. And this is a space where that can happen. And so I appreciate everything you've done to create belonging for children. But as someone who came into the Dubuque community, I belonged there, and it gave me a place to meet families that were like my own, that came from outside of our community. And it can be really hard in Dubuque to find friends when you're brand new. And that was a place where our entire family could go. We had at times, we've had 3 different kids on 3 different fields, but it's been great because it's the way that we come as a community together. So it's really hard to replicate that, and the foundation of it, not just, I hope, is seen by our Dubuque Community School Board, but our entire community as we look into supporting this. The other is that I believe items such as this need to be thought of in goal setting, my own thoughts, not just as recreational, but as a public health initiative. Finding ways to move children today is harder than ever. And there is no other space in this city where we could replicate what is currently there. And so children don't come to school if they're sick. Children don't perform in a classroom if they're sick. And there is no better medicine in this world than exercise. And so as we move into goal setting, I hope that we think of this not just as a recreational activity, but as a crucial piece of health and wellness of our children and our future. Thanks, Mayor.
Thank you, Ms. Whipple. You know, there are moments where you're kind of speechless up here because things have been said so eloquently so far, and I'm having one of those right now. I mean, this is, I think as we go into goal setting, I appreciate so much that we have community members like you reaching out to us to be able to talk about this. And I appreciate so much that we are looking at some of these things, not just as one item, but as items that fit within another category that we might be able to address. That's always the trick. It's always the thing we try to do as a city council, in my experience there, is you try to fit a number of things into one thing and see what you can do. But it is challenging. It really is. It is the most important thing that we do all year long as a city council is come up with how we are going to focus the efforts of our entire city staff and then the entire community in many ways on how we're going to work with that and move forward. So I very much appreciate that you've given us this letter and given us something to think about as we move into that next week. I think it's pretty clear from the comments here tonight that we're already thinking about that. So we appreciate that very much. All right, we have a motion on this particular item by Mr. Resnick and a second by Ms. Farber. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones.
Aye.
Kavanaugh.
Aye.
Farber.
Aye.
Wethel.
Aye.
Roussel.
Aye.
Sprank.
Aye.
Motion passes 7-0.
Action item number 3 is letter of support for Dubuque Soccer Alliance bid for Dubuque Soccer Complex.
Mr. Mayor,
Mr. Jones.
I move to receive and file and send the letter.
Second by Sprank.
We have a motion by Mr. Jones and a second by Mr. Sprank. Krenna, please.
It's not a memo, but would you like me to read the letter into the record?
Sure.
Okay.
Yeah, that would make sense. Thank you.
All right, so the letter reads, "To whom it may concern. The City of Dubuque has been represented on the Dubuque Soccer Alliance Board to help assist with planning, bylaw, and policy development, grant writing, and the donations of resources such as mulch and playground maintenance since the creation of the Dubuque Soccer Alliance in 1993. In fiscal year 1999, the City of Dubuque partnered monetarily in the capital funding of $45,000 for a playground and $134,000 to connect the sewer lines to the new concession stand. In 2012, the Leisure Services Manager, Marie Ware, participated in conversations between Dubuque Soccer Alliance and the Dubuque Community School District that led to the approved current Second Amendment to the lease agreement from May 10th, 2013 to May 9th, 2023. Attached to this letter, I have included information about the Dubuque Soccer Alliance and the Dubuque Soccer Complex. The City of Dubuque is supportive of the Dubuque Soccer Alliance being able to continue with soccer programming for area youth at the Dubuque Soccer Complex and hopes that the Dubuque Soccer Alliance has the bid that is accepted by the Dubuque Community School District. Signed sincerely, Michael C. Van Milligan, City Manager."
Thank you very much, Krenna. All right, open this up for discussion and questions. Well, the one thing I will add is, I think this is where sometimes things get difficult as an elected official because we have other local elected officials who have a job to do as well. And it's very similar to what our job is. I'm very happy that, and I'm looking forward to voting to send this letter because I'm very happy that we are encouraging our community to think about this and also encouraging our school board to do so. And I think that it's important that we do speak up when that moment is, when that comes in front of us, when some of these things are there, because of all the reasons that we've mentioned here. So I'm glad to see that we're moving forward with this, and we are very hopeful, or at least I am very hopeful, that the Soccer Alliance does have the bid that is accepted by the Dubuque Community School District. And I'm happy to give my support, at least, in voting for this. Any other comments? All right, we have a motion by Mr. Jones and a second by Sprank to receive and file and send the letter. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones.
Aye.
Kavanaugh.
Aye.
Farber.
Aye.
Wethel. Roussel.
Aye.
Sprank.
Aye.
Motion passes 7-0.
Action item number 4 is National Low Income Housing Coalition Out of Reach Report.
Mr. Mayor,
Mr. Resnick.
I move to receive and file.
Second.
We have a motion by Resnick, second by Roussel. Karen, I'll come to you.
Housing and Community Development Director Alexis Steger is submitting information to City Council about the 2020 to 2022 City Council goal and priority, quality affordable housing creation.
Mayor, City Council, Alexis Steger, Housing and Community Development Director. Sorry, I'm getting stuff ready here.
All right.
So tonight I am just going to give you a brief report. Comes from the National Low Income Housing Coalition. It's called the Out of Reach Report. This report is released annually, and they do it by state, but they also break it down by county. And what this does is compares the annual average wage of the area to your fair market rent. So currently, just for the state of Iowa, the report shows that it would take $16.55 per hour to meet the fair market rate of a rental unit, and that's in the state of Iowa. When you start breaking that down into counties, and I know this is hard to see as part of your packet, the Dubuque Metropolitan Statistical Area actually is only 1604, so we're a little bit less than the average for the state. So it would take two-bedroom households $16.04 per hour to be able to afford a rental unit at fair market rate. So what does that actually mean for the city of Dubuque? What we currently have is fair market rent. I just want to explain quick. Fair market rent is actually a calculation based on not necessarily your market, your current market. Fair market rents are released annually by HUD with a calculation based on wages and mortgage rates and several other pieces of the calculation that would make it affordable for a landlord to make money in the market as well as someone to afford that unit. So it's a little bit of a balance. But what we actually see in Dubuque, and is part of your memo, is that we have a very low vacancy rate. And because we have a low vacancy rate, we do not have very many two-bedrooms that are available for our fair market rent. So our fair market rent is currently close to the $860 that it's showing in Iowa. And when you go out to Zillow and Facebook Marketplace, which are two of our big ones that are used by our landlords for posting vacant rental units, there are only a few two-bedrooms available. I did list them in the memo. There were about 5. 2 of them were low-income housing tax credit units, so they are required to be affordable for an area median income of 80% of less or 60% or less. So those do meet the $14 an hour that is the average minimum wage or average wage for the city of Dubuque renters. So we had 2. The other ones were all about $1,100 a month, which is well over the $860, and you do have to include utilities with that. That means that our average renter, it needs a 2-bedroom unit, is making $14 an hour in wages and needs over $18 an hour to afford their unit. So we are not matching. Part of that is there's a lot of things that we can do, and we've brought to the council before. So I just wanted to show this is an annual report coming from the National Coalition, but it is supporting what we're bringing to City Council, saying we need more affordable housing, we need more workforce housing, but really we just need more housing units so that we have more availability. People can move if they're in a cheaper place and they can afford something bigger. It even helps to have market rate units so that they can make their move and we have affordable units then become available. We got to get that vacancy rate down, increase the amount of units we have. But the other part of the story is increasing wages. So obviously we need to also start increasing the wage for our average renter. The average wage in Dubuque is about 1604 for what you need for housing, and we're at 14. So how do we get that up? How do we get our employers to start seeing that to be able to afford a unit in the city of Dubuque, we really need those wages to start meeting in the middle with our fair market rents. So we got to bring the rents down and we got to bring the wages up. So that's really all I have for you tonight. I just wanted to present this and just show that this is what we're showing in our work sessions, coming up with city council goal setting, keeping this at the forefront of our priorities.
Thank you, Alexis. Appreciate that. Discussion.
Mr. Mayor.
Yes, Mr. Resnick.
Yeah, thank you. So you're saying that the average wage is $14 an hour here in Dubuque?
For renters, yes. For those that rent, so they do separate it in the report between renters and homeowners. Our average renter wage is $14 an hour.
Well, yeah, that's got to be pretty scarce anymore, $14 an hour. I mean, everybody is I mean, I see it even on, other places putting on bigger numbers than that. My other question is, would you say that this organization is objective?
I would say the National Low Income Housing Coalition has an agenda, as do several others, but to bring to the forefront the voices of the citizens that don't have the voice to bring to you. So although they may be focused on affordable housing, often those that need the affordable housing can't come to you to tell that story either. So they are, their mission is to tell that story.
So could we say, though, that number 45, can we generalize a little bit that says that things are pretty good here in Iowa as far as affordable housing if we're number 45? Or is that, it's better than 30 or 20 or 10?
If you were to actually use the fair market rents and they were established in Dubuque as the fair market, as the rent that you're going to find on the market, as opposed to fair market rent, then yes, 45 sounds like a great number, even though it is a nationwide crisis. So affordable housing is a nationwide problem. So even being last would, although we're doing better than everyone else, we're still not meeting the needs of our residents.
Okay, thank you.
Thank you, Mr. Resnick. Other discussion? I guess for the sake of discussion, I want to just kind of push back a little bit on some of the comments I was hearing from Mr. Resnick here, just because I think it's helpful as we go into goal setting and talk about this. First of all, the 1405 number, I'm trying to figure out exactly where that came from. It wasn't just a number these guys pulled out of a hat, right? This was a number that, am I seeing this correctly, that this is actually coming from census data?
Right,
Or
that comes from the census data.
Okay, yeah, because it's AMI data that they're pulling this from. So the numbers as far as wages and things like that we're finding on here are things that were accurate at the time of this report based on census data that was put out.
Right, and the
Okay.
census data is a little bit delayed from this, so there is a little bit of gap there.
Right. Yeah. There's always going to be a bit of a gap with that, but for the most part, we're seeing the same. We're getting this data from someplace and so that way, when we look at anything across the state of Iowa, we know that data is going to be pretty much in line with what the census data is telling us. So, as far as doing okay, I guess my challenge with this is I don't hear anybody saying that housing is okay anywhere, really. Really, all I'm reading right now is that we have a full-on housing crisis throughout the entire United States, and that if we want to be a state or a community that people want to move to, then we have to have a place for them to live. And we have to make sure that we're doing that in a way that is going to draw in, because you mentioned it yourself, Alexis, when you're able to draw in multiple different categories of people based on how much people make. So you want to be able to make sure that you have apartments that rent at higher rates that people can move into to open up the apartments for people who don't have as much money to be able to do that. Mm-hmm. Another question I had about this report too, because I apologize if I've just missed it, but I'm trying to find it. What does this say about people on fixed incomes? Does this have anything to do with people on fixed incomes, or are they just looking at wages as far as you can tell?
They only look at the wages compared to the fair market rent. Mm-hmm. They did not go into Social Security or fixed income and percentage of increase that would be required to support this same wage, basically. Yeah. They didn't do that.
Because really, when we look at housing, is that not one of our biggest challenges at this moment, is the fact that we have an aging population in the state of Iowa and in the city of Dubuque, and that people that are aging into using Social Security as their primary income, for example, or their retirement income, are going to be on a fixed income, mm-hmm. and then still looking for places to live, oftentimes downsizing into apartments, then taking that apartment off the market because they're living in that apartment. So it's not that this is, I don't want to call it a problem, because we love everybody who wants to live in Dubuque, right? But as a challenge, That's a pretty big challenge, is that we have an aging demographic, and to open up spots for people who are younger and able to make an hourly wage still because they're in the workforce, that's going to be really challenging because that's the housing that we're lacking in right there.
Yeah, that's correct. Yep.
Okay.
And we do have, obviously, our low-income housing tax credit. We had the new senior development out on Radford Road. So we're making strides. You know, we had a few Applewoods come through. So each year we're seeing some additions to the 55-plus area for units, which does help if you do have somebody moving out of an affordable home for home ownership to move into those apartments. But it does take almost all of the focus of the low-income housing tax credit. We had our first family unit in 5 years actually go up in Radford Road because they were all senior before that. So it does take a little bit of focus away, but it helps the home ownership side then. So like I said, any of those units that you can get in Dubuque is really going to help that mobility so that we have kind of just a better market for all residents.
Yeah. And one more thing before I bring back the table, I heard you also say in your report that you're, this is also something that employers need to be looking at to be able to raise the wages that we're working. And that makes me think about the fact that this is an all hands on deck situation. I mean, we don't just need more developers to create more housing. We don't need more units. We don't just need more houses or just apartments. We need it all. We don't just need higher wages, but we do need higher wages for sure. We also need, we just had a conversation about an amenity that's very important to the community. We need to be thinking about all these different things, in my opinion, I should say, as we think about how we approach this particular problem. Because if we're not looking at the housing issue, while also at the same time looking at community amenities and wages that people are going to be making, then we're not looking at the housing issue correctly. We have to look at it as a holistic issue. Okay, definitely. Back to the table for anyone. Mr. Sprank, and then Ms. Webb.
I agree with all of this, that we do need to figure out how to address this. But I study history and I pay attention to things, and even short term and long term, and I feel like to some extent this will cycle around again as it has before. I remember when IBM first came to town, all of a sudden rents went up because everybody assumed that IBM was a high-paying employer. I'm so happy Simmons has come to town because it has forced a lot of folks to realize, whoa, if they're going to start at this high of a level, everybody else has to match it. So I guess the biggest thing is what you're saying, $16.55 is what we really need, but what happens when all of a sudden we've gotten up to 18, and I just feel like people are just going to continue to raise rent. So I don't know if this is attainable, like we're always chasing our tail, so to speak, but I want it to be so. Any suggestions, Alexis?
It's definitely increasing the number of units, because you're not going to raise your rent if no one's going to rent from you because there's another unit down the street. So supply and demand. Basic supply and demand on that one. As they go up, you have to have the units, or you're right. They'll pay more because I can pay more, and then I need to be paid more. But you have to have the units. That's why you got to balance both out. It's not one focus. Just as the mayor said, it's the holistic view of what we need to supply. And employers are coming to the table. Is kind of what Councilman Resnick had said. That. We used to be at 14. It's starting to look like they're going to increase those wages because they need the labor. But if we don't add units, then they're just going to increase rent because they can get additional rent. And, it is a business, so.
Ms. Webb.
First, thank you for being a voice for people that have no voice, because to me, that's what this report really is. And I hope that people read about this in the paper tomorrow. And I hope that people see what we need. Because it's a crisis. And I don't think this even is the tip of the iceberg. In my own line of work, I see and have seen since the pandemic multiple households moving in with family members who have stable housing. And so this doesn't even touch those folks. And there are hundreds of those families in our city right now who have a couple or a single parent with multiple children moving in with a parent or their own grandparent. So a great grandparent housing other generations. Now, if that's by choice, wonderful. But if that's by force because there's nowhere for these folks to raise their kids, that's devastating. And those numbers aren't even here. And so I can't reiterate enough just professionally what I see and how important housing is. And so we need to, going into what we're doing next week, keep those people in mind because they have no voice and they're not even in this report. So thank you for your work. Thank you.
Anyone else? All right. Well, thank you very much, Alexis. We appreciate your time. Motion is to receive and file. Motion by Resnick, second by Roussel. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones.
Aye.
Kavanaugh.
Aye.
Farber.
Aye.
Wethel.
Aye.
Roussel.
Aye.
Sprank.
Aye.
Motion passes 7-0.
Action item number 5 is City Fiscal Year 2023 Update to Dubuque County Resource Enhancement and Protection 5-Year Plan and City Council Representative to REAP Committee.
Mr. Mayor,
Mr. Jones.
move to receive and file the documents, appoint Councilmember Sprank as the city representative, and approve.
Second.
We have a motion by Jones, second by Farber. Krenna, do you?
Leisure Services Manager Marie Ware is recommending City Council approval of the City of Dubuque's FY 2023 update of the Dubuque County REAP Plan and confirming City Council Member Danny Sprank as the city representative for FY 23 and FY 24 to the REAP Committee. The City Manager concurs with the recommendation and respectfully requests Mayor and City Council approval.
Thank you, Krenna. Any discussion? Mr. Sprank, are we willfully appointing you?
Yeah.
All right, wonderful. Good to know, on the record at least.
It's a good question.
All right, thank you for your service on this. All right, well, then we have a motion by Jones, second by Farber. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones.
Aye.
Kavanaugh. Farber.
Aye.
Wethel.
Aye.
Roussel. Sprank.
Aye.
Motion passes 7-0.
We will move on to council member reports.
Any council member reports? Mr. Sprank?
Saturday morning, I helped out the food harvest giveaway, the labor harvest food giveaway, and had an interesting discussion with them and probably might bring this up in goal setting. They are desperately seeking some funding. They get a lot of funding from the county, but they needed that to buy a new truck to go get all the food. So if they don't get some substantial funding, they may not be able to operate next year. And let's see, Saturday, I lugged out nearly 150 boxes between 3 other people. I think there's 352 boxes that were given out total. So, and I think they give out another 100 to 150 during the rest of the month. So they do a lot for the neighborhoods. Something to think about. Thank you.
Thank you, Mr. Sprank.
Mr. Mayor?
Ms. Farber?
So I have a all smiles story with the Miracle League, which was in action on Thursday of last week, thanks to Fox Sports and the families and all the players. It was just a wonderful day, and the young participants, those young athletes, whether they were walking or whether they were being helped by a buddy from one of the high school baseball or softball teams, was just heart-touching. And I have been in conversation with Fox Sports as a result of us being there, and they were just in awe as well and very appreciative not only of the opportunity, but we expressed our appreciation for providing that opportunity and just all the fun. And these kids were just smiles from ear to ear. Families were just so pleased, and it's just very, very heartwarming. And thanks to Mr. Resnick for being there as well and introducing the morning. So smiles all around.
Yeah. It's one of the best events of the year. I
It
think.
was.
Mr. Mayor.
Yes, Mr. Jones.
Well, the rest of last Thursday didn't suck too bad either, it sounds like. So just got to give a shout out to the city of Dyersville for all their preparation and work, and to our team at Travel Dubuque for helping to pull it all together, because the Midwest is absolutely on the map yet again in the most positive way.
Yeah. It's amazing to hear people talk about the experience who are not from here during that game. You know, it just is, it's a proud moment for all of us, and it makes me proud of the steps that we've taken as a council to definitely support this. So thank you, Mr. Jones. Ms. Wethel.
I attended the Fountain of Youth graduation on Saturday, and Chief Jensen spoke and gave remarks, but these are folks who get up and try and make a commitment to change. And they're a great example in our community of what you can do when you make that choice. So it was a privilege to be there, and the Fountain of Youth does great work.
Thank you, Ms. Wethel. Well, appreciate these reports tonight. I'll add one piece to that. This goes a little farther back, but the Art on the River exhibit is now fully installed, and we had a wonderful reception. I was very honored to be the MC for that reception and be able to move that initiative forward for yet another year. But if you haven't had a chance, go down and see the Art on the River exhibit. You'll be able to go down there. Maybe you can go when you're enjoying the Hooli later this month. There's some other great event on the River Walk, but it's absolutely wonderful again this year. All right, well, we do have a closed session, so I'd entertain a motion.
Sure, Mr. Mayor.
Mr. Jones.
Move that the council go into closed session to discuss pending real estate transfers in accordance with Chapter 21.5 of the Code of Iowa.
A motion by Jones, second by Resnick. For the record, the attorney the city council will consult with on the issues to be discussed in the closed session is city attorney Corinna Brumwell. Adrian, would you call the roll, please?
Resnick.
Aye.
Jones. Kavanaugh.
Aye.
Farber.
Aye.
Wethel. Roussel. Sprank.
Aye.
Motion passes 7-0. We are in closed session.